Hello and welcome. If you're watching this, it's probably because you or someone you love is trying to figure out this whole long COVID situation. Well, today we're going to lay out a clear roadmap to recovery. We're going to talk specifically about something called pulmonary rehabilitation and how it can be an amazing tool to help you start feeling like yourself again.
Look, getting a diagnosis like this, it can be really unsettling. It's a journey that's just filled with question marks, and it is completely 100% normal to feel worried about what the future's going to hold.
You might be wrestling with that fear of losing your independence, or this nagging worry that you just can't do the things you love anymore. Or maybe it's just that constant background hum of anxiety, not knowing what's coming next. I really want you to hear this. Those feelings are so valid, and you are definitely not alone.
To start moving past that fear, the very first step is always understanding why. So let's dive in and take a look at what's actually happening inside your body that's making you feel this way.
So, long COVID, or what doctors might call post-COVID conditions, it isn't just one simple thing. It's actually a pretty complex syndrome that can affect your whole body in a lot of different ways. And that breathless feeling you're having, well, it isn't always coming from just your lungs.
So what is causing this breathlessness? Well, there are a few different culprits. For some people, it's inflammation that just won't go away, or even some scarring in the lungs. For others, it's damage to the tiny blood vessels. Think of it like little traffic jams that stop oxygen from getting where it needs to go. It can also be simple weakness in your breathing muscles from being sick. Or, and this is a big one, your body might have just picked up an inefficient, shallow breathing pattern as a bad habit. Each one of these is a real, physical thing that we can tackle directly.
And this right here, this is a really crucial piece of the puzzle for your recovery. You've probably experienced this. You have a pretty good day, maybe you do a little too much, and then bam, you crash for the next day or two. That has a name. It's called post-exertional malaise, or PEM. Understanding and learning how to manage PEM is the absolute key to a safe and effective recovery.
Okay, so now we get the problem, let's talk about the solution. I want you to think of pulmonary rehab as a bridge. It's the bridge that connects where you are right now to where you want to be, feeling stronger, more in control, and way less breathless.
The first part of building that bridge is fixing your breathing. You see, after being sick, a lot of us develop this stressful, shallow way of breathing that just uses our upper chest. Rehab teaches you how to retrain your body's main breathing muscle, the diaphragm, through what we call belly breathing. By using this super powerful muscle at the base of your lungs, you pull in so much more air with way less effort. It makes every single breath more efficient and, honestly, more calming.
The second part of that bridge, it's all about rebuilding your strength. It's natural, being sick and not moving around as much makes your muscles weaker, and that includes the muscles you use to breathe. Rehab uses gentle, really carefully progressed exercises to safely build that strength back up, which makes everything from just walking across the room to climbing a flight of stairs feel so much easier.
So, the big question, does it actually work? Let's just look at the data. On average, patients with long COVID who finish a pulmonary rehab program improve how far they can walk in 6 minutes by almost 78 meters.
Now, 78 meters might just sound like a number, so let's put it into perspective. That improvement is not just significant, it's actually a bigger gain than we often see in people with other chronic lung diseases. And what does that distance feel like? It's like being able to walk almost the entire length of an American football field farther than you could before you started. That's not just a small improvement, that is a life-changing difference.
And these improvements, they happen on a pretty clear timeline. Most people start to see real gains in their physical ability within the first 4 weeks. By about week 8, you're often hitting your peak physical gains and noticing a genuine improvement in your quality of life. And the best part? Even after that, the benefits keep coming, especially when it comes to reducing that deep, draining fatigue.
Okay, so what does all this actually look like when you're doing it? Let's pull back the curtain and see what you can expect to be doing in a typical rehab session.
The most important rule, the guiding philosophy, is start low, go slow. This is not about pushing you to your absolute limit. Nope, it's the total opposite. Every single program is personalized just for you, with a laser focus on careful pacing so we can build you up without triggering that post-exertional malaise we talked about. It is all about being safe.
You might start out with really gentle movements while you're sitting down, things like ankle pumps or simple arm stretches. As you get stronger, you'll move on to things like sit-to-stand exercises to build up your leg strength. And eventually, you'll get to slow, steady aerobic work, like walking on a treadmill or using a stationary bike to build up your endurance. It's all a gradual, totally manageable journey. This might all be sounding great, but you're probably wondering, how do I even get started? Let's make the path forward super simple and crystal clear. It's really just 3 easy steps. First, talk to your lung doctor or your main doctor and ask for a referral to pulmonary rehab. Step 2 is just to connect with the program. Give them a call, visit their website to learn more and get your questions answered. And from there, you'll schedule your first evaluation where a team will design a plan that is built just for you.
And here is some really fantastic news. Worries about cost can be a huge hurdle, right? But in a major policy update, Medicare now officially covers pulmonary rehab for persistent symptoms after COVID-19. And a lot of private insurance plans are following their lead, which makes this incredible therapy more accessible than it has ever been before. As we start to wrap up here, I just want you to hold on to this one thought. You are not alone on this journey. Hundreds of patients, feeling just as worried and uncertain as you might be feeling at this very moment, have walked through these doors.
They put in the work, they trusted the process, and they got better. They got their strength back, they regained their independence, and there's every single reason to believe that you can too.
The path to getting better really begins with just one decision. So the only question left is this: are you ready to take that first step?
You have the information now. You know there's a proven path forward. So the next move is yours. We really hope you take that first step today and begin the journey back to feeling like you again.